Good afternoon, everyone. Thank you for joining us today. I'm Liz Charlotte, Director of Communications at the Mississippi State Department of Health, and we have a lot going on. I love breaking news just as much as you reporters do. The big news is that for the week ending December 25th, the majority of our cases are now Omicron. Delta has gone down and Omicron is up, and Dr. Dobbs and Dr. Byers will talk about that in a minute. We're also going to talk about the increasing case numbers, up 80% from last week. As you all know, there's a limited supply of monoclonal antibodies, both for Delta and for Omicron. Good news, we are expanding our testing sites throughout the state, and Mr. Jim Craig will tell us more about that. And then we'll talk about available resources and what the public, what you all can do to help. So again, thank you for joining us. Dr. Dobbs, let's talk about the incredible increase in the case numbers.
Yes, thanks, Liz. So Mississippi is seeing a rapid increase in the number of cases and also a significant rise in the number of hospitalizations due to COVID-19. For the previous week, leading up to December 25th, 59.6% of all identified cases were due to the Omicron variant, and the remainder primarily due to Delta variant. But as of 12/20 and forward of the specimens we've now analyzed, 67% are due to Omicron. Now, Omicron is significantly more contagious than Delta, but fortunately, it does appear to cause less severe illness. But regardless, we will continue to see additional hospitalizations and deaths, and many of which could be avoided. Important to reiterate that vaccination is still an important measure for COVID, especially for Omicron. Boosters are critically important. We know to get full protection against Omicron, folks need to have a booster. And if you've had a recent booster, the protective effect from clinical illness can be as high as 70% or more. So please get your booster if you have not done so. But even so, folks who've been vaccinated are protected from the most severe outcomes of COVID as far as severe illness, hospitalization, and death for the most part. Vaccinated people and those with prior infection can still get COVID with the Omicron variant and spread it. So it's important for people to be safe. You know, we don't have a lot of the monoclonal treatments available right now. We're trying to deploy them as quickly as we can. Most of the monoclonal treatments that we have are not effective against the Omicron variant. So it's important to prevent getting COVID right now while we're waiting. Additional doses of the oral antivirals, which we'll discuss a little bit later on, and then the single form of monoclonal antibodies that is useful against Omicron called sotrovimab. So for the next couple of weeks, please be especially careful especially going into the New Year's holidays. We know how to prevent transmission of COVID. We've seen a lot of transmission in congregate settings. We've seen almost a fourfold increase in the number of outbreaks in long-term care settings. We've seen a lot of outbreaks in social events and in other gatherings. So please be very careful as we go into the next couple of weeks. And I'll kick it over to Dr. Byers.
Hey, thanks, Dr. Dobbs. And, just to reiterate what Dr. Dobbs was talking about, we are seeing some pretty rapid growth in our case numbers. And, I know that many of y'all are experiencing this. You probably know people who are infected and how easily it's being transmitted right now. We're seeing rapid growth in nursing home outbreaks. We're reporting out over 140 long-term care outbreaks today. Of those, 100 are nursing homes. When we look at that compared to just about a week ago, I think we had a little bit over 60 overall long-term care outbreaks, and of those 40 were in nursing homes. So we're seeing rapid growth in nursing home outbreaks, but we're also getting reports of increased outbreaks that are occurring in social gatherings, really wherever people are gathering, especially indoors. We're reporting out over 3,500 additional cases today, just in that one-day report. Of those, we have 19 additional deaths. When you look at this last 7-day period, just going back 7 days, we've had over 10,000 cases that have occurred. And when you compare that to the previous 7-day period, we're really at twice as many cases just in a 7-day period, and that's how fast we're seeing things grow. In addition to the outbreaks, we're seeing increased demand for testing. We did over 80,000 additional tests last week in the state. Our percent positivity is raising to about 11% now. And so, with the outbreaks, with the increased cases that we're seeing, with the increased demand on testing, with the percent positivity going up, when you look at overall in Mississippi, we're at high to substantial levels of community transmission, really in all parts of the state. We really are in the fifth wave now of COVID for Mississippi. And, our hospitalizations are increasing rapidly as well. And I know Mr. Craig is going to talk a bit more about hospitalizations, but we've seen a rapid increase in the number of new admissions for folks going into the hospital. We've seen some kids in the pediatric ICU for COVID. And so it's all going pretty rapidly right now. We don't have a lot of impact on the schools, right now, but they're out. I anticipate that by the time we get the schools back, that we will see some impact in those settings. The schools have historically been a reflection of what's going on in the community, and we're seeing a lot of community transmission right now. So I anticipate when the schools get back that we will see a substantial number of cases that are affecting those school-age kids. When we look at where most of the cases right now, it's in the younger folks. That's kind of been where the rapid growth typically happens when we have a new variant that jumps in. And so those folks 25 to 39, that's where we're seeing most of our cases now. That's the rapid growth. We're also seeing some increases in kids between the ages of 18 and 24. And so, these are the people that are usually out and about more, and we have a potential for increased spread with those individuals. When we look at the deaths, however, the majority of deaths are still occurring in people 65 and older, and in people 50 to 64. These are the most vulnerable people. This is where the real impact is, and we need to make sure that we keep those folks protected. When we look at our strategies for treatment, Dr. Dobbs had mentioned that our overall supply of monoclonal antibodies, which have been an enormous benefit for us for treating COVID early in the course of illness, are in short supply. The Regeneron product that we've used quite a bit throughout the pandemic, the bamlanivimab and etesevimab product are in short supply, and they're really not effective against Omicron. But it's important to understand that we are still seeing some Delta in the state. It's rapidly declining as we see Omicron increase, but we are still seeing some Delta that's occurring. We are distributing these limited supplies out that we have to the hospital centers of excellence. We also have a very small supply of sotrovimab. This is a monoclonal antibody that has retained activity for treating and is still effective at treating the Omicron variant. And so we are distributing that out to some hospital centers of excellence as well. We're working hard to get additional monoclonals to the state. We're working with providers throughout the state that still have a surplus of some of the monoclonals to pull that back in and redistribute it as needed to those places that are seeing the highest activity. And we hope to obtain additional monoclonal antibody treatments next week and in January as well. And so we're working hard to get more, but people need to understand that these are in very short supply right now. And we are distributing out to those centers of excellence that we can to get those treatments in folks. We do have oral antivirals coming on the horizon as well, molnupiravir and Paxlovid. Both of these are used in outpatient settings and can be used to treat in the very early part of the illness. But overall, we have less than 3,000 doses of those that have been allocated to the state. Now, we are going to be distributing out some of these that will be available to select centers of excellence, hospitals, and FQHCs later this week and really early in next week, as quickly as we can. And we're hoping to get more of those antivirals available and in the state by the first couple of weeks of January. But again, these are in short supply as well. So what do we need to be doing right now? Make sure that you're vaccinated if you haven't been. We know that our vaccination rates are still relatively low in the state. Only 48% of our total population has been fully vaccinated so far. And of those, only about 29% have received the booster. We know that with full vaccination, and especially with receiving the booster dose, that you can blunt the impact of the infection from Omicron. You can reduce the severe illness, reduce hospitalizations, and reduce deaths. That's one of the keys. But also, wear a mask when you're in indoor public settings. Think about those public settings that you're going to and try to limit those interactions outside of your immediate family. Wear a mask when you're at work. Wear a mask when you go out in public. Masks do work at preventing transmission, and that's very important. So, these are the keys to moving forward. Our vaccination, thinking about where we're going and what we're doing, wearing a mask when we can. And CDC, and this is the last thing I'm going to say, because I feel like I've been talking for 20 minutes. CDC has modified and shortened the isolation and quarantine periods for individuals who are either infected or have been exposed. And so, if you've been infected, instead of a full 10-day isolation period, CDC now says 5 days of isolation. That means at home, away from everybody else, so that you don't transmit it to anybody. And then you can come out of that isolation and continue to do activities outside of your home as long as you're wearing a mask at all times. And that's going to be the key. If people adhere to that and that simple piece, then we can help reduce some of the transmission. We know that most of the transmission that occurs when a person is infected is early in the course of illness or in a couple of days prior to illness. So, make sure that if you do come out of that isolation after 5 days, if you're going out and about, wear a mask. If you have been exposed to COVID and you've either gotten a booster dose or you've been fully vaccinated within the last 6 months with an mRNA vaccine or fully vaccinated with Johnson & Johnson in the last 2 months, then you don't have to quarantine. It's recommended that you wear a mask for 10 days to prevent you from transmitting it to other people if you do happen to have a breakthrough infection. But you don't have to quarantine at the house if you meet those criteria. If you haven't been fully vaccinated, if you haven't, or if you've been fully vaccinated, but it's been more than 6 months, or if you haven't gotten that booster, then if you're exposed, quarantine for 5 days at least. Sit at the house. If you come back out, you can come back out after 5 days, but you got to wear a mask. And so please adhere to those. I'm not going to try to interpret all of the nuances of that CDC guidance, but it's out there. And we're recommending that people adhere to that guidance. So Dr. Dobbs and Liz, I'm going to turn it back to y'all. That felt like that was a whole lot of information, but we can certainly answer questions.
Okay, thank you, Dr. Byers. So, Mr. Craig, let's talk about the good news first. Will you enlighten us about the expanded testing statewide?
Yeah, Liz, and thank y'all. We have, as Dr. Byers said, we've seen a lot of demand for testing in our state, especially this week. Remember that COVID testing is widely available through our partners, including physician offices, the federally qualified health centers, our participating centers of excellence providers. There are just a number of people providing testing in Mississippi. You might also recall that in counties where there was very little or no free or no cost testing, that MSDH has contracted with Maverick Health to provide some testing. Most of these locations are at our county health departments, but a few are at some of the larger venues so they can accommodate the increased volumes. So starting this week, we began expansion of COVID testing capacity around the state to try to meet the increased demand. I do have a couple slides I'd like to share real quick, just to go over some of that increase. You see the slides? So currently in our community testing plan, we have 41 sites in Mississippi that Maverick Health again is providing this testing around the state. If you look at some of the changes that we've made this week, we've increased the number of testing appointment slots at the Adams County Safe Room, Claiborne County Health Department, the Oklahoma County Health Department, at our Hernando location in DeSoto County, in Hancock County, Harrison, in Jackson County, in Lafayette County at the Oxford Conference Center, in Lee County, Lincoln County, and Lowndes County. You'll notice that both in Lafayette and Lowndes County, we have doubled the number of slots that were available previously in those two counties. Also, if you look at Marion, we increased from half to full days at the county health department there. Marshall County, Panola County, Pearl River County. In Scott County, we went from 3 half days to 4 full days and increased the appointment slots there Tuesday through Friday. In Stone County, we've increased from half days to full days and increased appointment slots, and also in Tunica County. We look at Trustmark Park in Rankin, we doubled the number of appointment slots, and we will also be operating New Year's Day from 8 o'clock till noon at the Rankin County location at Trustmark Park. In Himes County, in our farmers market, we'll also be operating New Year's Day for their normal half-day schedule, but they operate on Saturdays. And in DeSoto County, today, working with DeSoto County local officials, they're providing the South Haven Community Safe Room as another location in DeSoto County. So we're operating in the health department in Hernando, and starting tomorrow at the corner of Highway 51 North in Dorchester, we'll have an additional location in DeSoto County at the South Haven Community Safe Room. So we appreciate the work of the DeSoto County officials in securing a spot for some additional testing in DeSoto County. So if we look total appointments statewide since Sunday night, our slots have increased from 15,000 to a little over 20,000 slots. And currently, right before we started this press conference, 13,220 slots are booked at this time for additional testing appointments. So still a lot of demand in Mississippi for testing. We'll also remember that you can sign up for appointments to the UMC scheduler at covidschedule.umc.edu. And we will be making some further updates to our appointment system as increased slots are made available later today and ongoing. We'll continue to watch where the appointments are being made, and where we're short of appointments, we'll continue to try to add resources and additional appointment slots in those areas. But also remember, we're not the only outlet for COVID testing. Again, you can check with physicians, our COVID qualified health centers in the state, and our participating centers of excellence for additional testing opportunities. We have noted the supply of testing may be limited in some parts of the state, and we're working to continue to increase the availability of testing and testing supplies in our state. Also, remember, as Dr. Byers and Dr. Dobbs both said, that prevention is an important piece of this. Getting the vaccine, getting those booster doses are critically important right now. Remember that COVID vaccination and booster shots are widely available throughout the state, including our county health departments. If you need to schedule an appointment for either a COVID vaccine or a booster shot in the county health department, you can go to covidvaccine.umc.edu and make an appointment for one of those. Also, on the healthcare front, as you know, there is a national shortage of healthcare staff. And here in Mississippi, we're experiencing it just like the rest of the country. Our COVID-related emergency department visits during the first 3 days of the week were over 1,700 patients per day. We're also seeing a rapid increase in new COVID admissions, with 445 total COVID admissions in Mississippi hospitals as of yesterday. As Dr. Byers said, we're seeing high levels of community transmission in most of the state. You can always go to CDC COVID data tracker for more information on particular counties and what they're experiencing at this time. Also, as Dr. Byers and Dr. Dobbs explained, it's important to do everything possible to stay well and to lessen the burden on the Mississippi hospitals at this time. Current reports that we're getting from the healthcare system is that most Mississippi hospitals are still experiencing staffing shortages and have very limited bed capacities. We've also received reports that it's becoming increasingly difficult for some of our community hospitals to transfer patients to some of our larger facilities in the state, mainly due to the lack of staffing for those beds at those larger hospitals. Happy to report that our state stockpile of PPE is fully stocked and will continue to assist as needed. And while there have been reports of national shortages in some of the testing supplies, currently we're continuing to fill orders for testing supplies as requested, and as well as securing additional product from some of our testing vendors. So again, we're doing everything we can to work with our state and federal resources to obtain more testing material for COVID, monoclonal antibodies, and oral antivirals. With that, Liz, I'll turn it back over to you for questions.
All right, thank you. I appreciate you all identifying your media affiliate. If you don't, you're going to probably get kicked off of here, which we just had happen with the reporter. So please always identify yourself. Let's see here. Let me go to the first question. All right. Let's see here. Okay, the first question is from, well, I see Kingfish got back on there. Okay, let me. All right, Janice, and I did see that we did have a DeSoto County location. Janice, to Mr. Jim Craig, is DeSoto County adding a second testing location? If so, when and where? Is that the only one that you had up on the chart?
So remember that we're already at the Hernando Health Department.
Okay.
Providing 5-day-a-week testing, but we are opening starting tomorrow the Community Safe Room in South Haven, also in DeSoto County, to begin testing.
All right, thank you. All right, let's see. Let me go down to, okay, Scott Simmons. All right, Scott Simmons from APT. Does the health department believe there should be statewide restrictions and mask requirements in light of this outbreak? Dr. Dobbs, why don't you take this?
You know, without a doubt, we do strongly recommend that people wear masks indoors in public. Masks are effective. They do help prevent the spread of COVID. And when the person who has it and the person who doesn't have it are both wearing masks, it's highly effective at preventing transmission. This is especially important right now when we have such high levels of transmission. We do not anticipate that a statewide mandate is likely to take place, but certainly encourage folks in their businesses. We have a mask requirement in our office here at the Department of Health. We encourage businesses and organizations and even communities to do everything they can to ensure folks are masked. You know, this is this Omicron thing hopefully won't be here all that long. We need to do simple stuff right now to keep people from getting sick, especially while we're waiting on the arrival of really effective and, you know, much anticipated antiviral medications. So we're just at a vulnerable point right now, and we can use those simple steps that we know work to keep us out of trouble.
All right, thank you, Dr. Dobbs. I think this next one I'm going to send over to Dr. Byers. This is from Lacey at the Clarion Ledger. And let's see, she's asking about pediatric hospitalizations are way up. Is there a particular reason for that? How many pediatric hospitalizations overall? How many are 5 and older? Oh, it's a lot here. And unvaccinated versus vaccinated. Also, how many pediatric hospitalizations are under 5, not eligible for vaccination because of age? Dr. Byers, I don't know what.
Yeah, that's a whole lot of details that I don't have right at my hand right now.
Yeah.
I can tell you that we do have more kids in the ICU and in the hospital than we've had as we've sort of wound down with the Delta variant. When we talk about pediatric hospitalizations, we classify those children as under the age of 18. That's what constitutes pediatrics. But what I can tell you is that, you know, kids have gone to the hospital. Kids have gotten severe infection as a result of COVID throughout this entire pandemic. That's not new. We know that children can be vulnerable, although many times children have a less severe infection, and most of them do pretty well. But, you know, we do see cases of multi-system inflammatory syndrome in children that require hospitalization. We do see significant numbers of hospitalizations when we start to see increased transmission in kids. And, we have seen regrettably deaths in children, although not for quite some time now. And we hope that that continues to hold true. But what I can tell you about vaccinations is that we still have very low rates for our children 5 to 11 years of age for complete vaccination. Only about 4% of children in that age group have been fully vaccinated in the state. When you look at the little bit older kids, the 12 to 17-year-old kids, we still have relatively low vaccination rates with overall fully vaccinated about 35 to 40%. So, we're still lagging behind. We know that vaccination, especially in those age groups, can help prevent severe illness, hospitalizations, and deaths. We got to do better. We got to get more kids vaccinated for sure.
All right, thank you so much, Dr. Byers. And this next one is going to go to you, Dr. Dobbs. It's about one of your tweets. This is from Kobe Vance at MPB. Dr. Dobbs tweeted out a chart about a rise in visits to the emergency room. Could you elaborate on why that trend may be going upwards? Are those people who may not have been able to go to their normal healthcare provider because they were closed for the holiday? Or what are other contributing factors for that rise in ER visits for COVID patients? Dr. Dobbs?
I don't have any information that would speak to whether or not it's folks not accessing the normal care stream. But, in Mississippi, we do overutilize emergency rooms for general care. So I think that's not surprising. But the amount of ER visits, I think, is really more a reflection of the phenomenal increase in the cases that we've had. If you have, when we speak to our physician partners in the community, urgent care and that sort of thing, they are absolutely getting bombarded in cases. So it's not a unique phenomenon in emergency rooms. We're seeing a lot of visits outpatient all over the place. And it really seems like it's just a reflection of just the phenomenal increase in cases we've seen over the past couple of weeks.
Thank you, Dr. Dobbs. Let's go to Nick Juden. All right. I've seen enormous confusion about what to do after exposure or potential infection. First, testing availability seems to be rapidly evaporating. Well, we're expanding our testing here in Mississippi, so we're very fortunate. How should people react to a potential exposure or infection if they cannot access testing? All right, let's take that first. Let's see. I guess this is more of a medical. This first part is more medical. Dr. Dobbs, testing availability. We're fortunate we're expanding ours, but what should someone do if they think they've had a potential exposure and they can't access testing?
The most important thing to do is to prevent additional transmission, right? So if you feel bad or if you think you've been exposed, please stay away from other people. Don't perpetuate the chain of transmission. This is really a love thy neighbor sort of moment, and love thy family also. So, stay home. There is testing available. It's just not on demand like we've had before. It might be a day or two going forward. So we'll continue to increase access. But look for it out there because it certainly will be available. The convenience might not be quite as good as it has been, but this is a moment of phenomenally increased demand. So it'll be a little bit of a challenge. But please stay home if you can, and and look for testing. And if it has to be a day or so later, go ahead and schedule it so you'll be on on the schedule.
All right, thank you so much, Dr. Dobbs. Let's go on to, additionally, the CDC's new guidance suggests that asymptomatic individuals, we kind of covered this, but may exit quarantine after 5 days without testing. But many virologists have challenged these guidelines as economically motivated and contradictory to public health practices for exiting. All right, what is your guidance for exiting quarantine? 5 days, 10 days? I think you said 5 days, and then he's asking with or without a rapid test. Dr. Byers?
Yeah, so when in doubt, guys, if you can't get tested, let's go for a longer quarantine period. Certainly the CDC has guidance out there now, and we're going to say follow the CDC guidance that says, if you've been exposed and it's been 5 days, certainly isolate for those full 5 days first, or quarantine for those full 5 days first. then you can come out with a mask. Certainly testing is recommended. If you can get testing, let's do it. But if you can't get testing, let's opt for the longer quarantine period if you're concerned about it. Certainly though, if you do go out and about, especially after those 5 days, wear a mask, guys. Let's do what we can to protect people. And I think that's what we really want folks to understand. Follow the guidance as closely as we can.
Okay, I am going to skip the next question because we are trying to get that reporter back online. Let's go to Shalina. All right, this is Shalina from the Gulf States Newsroom and PR. With the Delta surge, we had a massive shortage of healthcare workers compared to the number of patients. Are you all worried about shortages this time around? Do you envision more resources like parking lot hospitals having to emerge again? Okay, let's talk about that first, Mr. Jim Craig. And a lot of those additional resources we had, Shalina, were federal resources. But Mr. Craig, would you take that, please?
Yeah, thank you for that question. So, are we concerned? Most definitely, we're very concerned about the continuing shortage of healthcare workers in the state that are available for COVID-related illnesses, but really for any related illnesses that we have, especially those that require intensive care.
Does this sound bad? Oh, I'm sorry, Jim. Go ahead.
In addition to that, remember that we're not the only state experiencing this increase in cases right now. Those federal resources and a lot of the other resources are in high demand all throughout the country. We'll be asking for resources the same as other states, and there are processes in the federal government to try to allocate resources as they can to states to be there just in time. So we'll continue to make sure that we ask for resources as we can to help out hospitals. But I am concerned that we are continuing to have a shortage of healthcare workers in our nation, but also right here in Mississippi.
Okay, so, and also you and I talked about this yesterday, Jim, that the more we're in this, the more we learn, such as reducing the number of quarantine days. So why don't, because you've had a lot of the operational stuff, what are some lessons learned from Delta that you all are applying to this situation? Jim, can you go ahead?
We operated some field hospitals, and they were very timely in some aspects, because we had additional resources that came to the staff. The issue that we had in Delta is very similar to what we can probably expect now, is that there are beds in hospitals. There are just not enough staff to staff all the beds. And I think we learned in Delta, the best place to care for folks, if we can, is to bring the practitioners, whether they're federal or otherwise, into the hospitals, and not so much try to set up a separate system and try to support a separate system. If we could just get those beds available, and especially those intensive care bed spaces available within the hospital to staff.
Thank you, Jim. Let's see. Okay, we're going to talk about schools, which we really, Dr. Byers, I know we don't have that much right now. Nick Juden is saying, I'd like to add the above. Well, let me, hold on a second. All right, I'd like to add to the above question by asking about schools in particular, which are not in session now. How do we anticipate the CDC guidelines affecting schools and school closures? Is there particular guidance from MSDH to schools and school administrators? Dr. Byers.
Yeah, that's gonna be a whole different situation for sure. And from talking to CDC, certainly they may be updating some of their school guidelines to align more closely with the updated shortened isolation and quarantine guidelines that have come out for the general public after infection or exposure. We do put out our guidelines, but typically we align with CDC, and we've gotten a lot of questions from schools and school administrators already about what do we need to do going forward. And certainly we know that it's going to be tough for them. We are recommending that they adhere to the CDC guidelines right now. It's hard to know how that may affect school closures coming down the road, because we have used sort of a metric of the number of students and teachers that are out on quarantine. If they have so many out on quarantine that it makes school difficult to keep in person, that they should consider at least a temporary virtual learning situation. We're going to have to see how that rolls out. A lot of it is going to depend on some of the internal practices that the school puts in place. But for sure, what we're going to recommend, because we do anticipate that there's going to be cases and going to be transmission within the school setting, especially when we've had kids at home where they've had opportunities to have exposures with family and friends and social gatherings, is when they come back, we may in fact see some increased cases that may make it difficult because of the number of cases that they have to continue in-person learning. Masks are going to be vital. We've recommended masks in the indoor school setting really this entire school year and last year as well. We really want to encourage parents, encourage schools to continue to wear a mask when you have your child, or if you're a teacher, wear a mask in that indoor setting in the school, really regardless of your vaccination status, guys. If we can do that simple measure of making sure that everybody's wearing a mask, we can really try to limit some of the transmission. Don't go to school if you're sick. Please don't send your kids to school sick. Get your kids tested, exclude them. And certainly, although there is a shortened quarantine period, we still want to make sure that kids that are exposed are quarantined appropriately during that time frame, even though it's shortened. We know from some additional data now that it's looking like the Omicron has a shorter incubation period, and we know that a lot of the transmission can occur early on in infection or just prior to this onset of symptoms. So if we can put those measures in place, don't go to school if you're sick, isolate if you're infected, make sure that you at least adhere to that shortened quarantine period and wear a mask, I think we can continue to have our schools meeting in person. But it's going to be real tricky, I think, coming back. Dr. Dobbs, we may have lost Liz. Maybe we just need to go to the next question.
I'm here. I'm sorry. Okay, so Courtney Ann Jackson is asking, do you believe those being hospitalized are still mostly Delta variant cases, or some of the Omicron cases worsening to that level among unvaccinated individuals? Why don't we start with that one first? Dr. Byers or Dr. Dobbs?
Yeah, it's almost certainly a mix. The proportionality of it's going to be pretty hard to know. Until last week, the majority of cases were Delta. It takes a little while for folks to get hospitalized, and then as Omicron came on full force last week, there'll be some Omicron hospitalization. So it's going to be certainly a mix. We do know that more severe illness occurs in unvaccinated folks, but one of the things that's important to consider is that age is such an important factor for severity of illness. So a good proportion of older folks are going to be in the hospital who are vaccinated just because most older folks are vaccinated. It's not because the vaccine didn't work. They're still multiple fold more likely to do well, but older folks are vulnerable regardless. And that's one of the reasons why the booster is so very important. We have way too many people, even people over 65, who haven't had the booster yet. So please, if you haven't taken an opportunity to get boosted, now's the time.
All right. Thank you, Dr. Dobbs. And Mr. Jim Craig, we talked about this a little bit, but Courtney is asking, at what point would additional measures to protect the healthcare system be considered? Are transfers getting difficult again? Can you take those two, Jim?
do that. So, we continue to work with hospitals and have conversations with hospital leadership to better understand some of the challenges that they're having and the needs that they may have, and try to assist them in ways that we can, and to help them execute their emergency operations plan the best that we can. As far as transfers, the reports that we've received from many of the hospitals in the state are that it is becoming increasingly difficult for our smaller community county hospitals to transfer patients to some of our larger centers. And the reports from that are mainly due to a lack of staff beds at some of those larger hospitals. So it all plays back to that staffing issue. We have got a staffing shortage in this nation, and it's here in Mississippi as well.
Thank you, Jim. Let's see. Oh boy. All right, Isabella Murray with the Sun Herald. How dependent is the state on monoclonals right now as treatment? So we talked about that a little bit. Many Mississippians who are unvaccinated rely on the antibodies if they get COVID. So is the state ill-equipped to handle the fifth wave with the shortage of this treatment? First of all, Mississippians should not be counting on monoclonal antibodies as opposed to getting the vaccine. That is absolutely a wrong move. So get your vaccine, get your booster or your third dose. But where you're asking about, let's see, are we ill-equipped to deal with it? Right now, I think we have a small supply of monoclonal for Delta and Omicron. Dr. Dobbs, that's correct?
Yes. So as Liz mentioned, we've always said that vaccination is plan A and monoclonals are backup. So, you don't depend on your backup quarterback when you got your main guy up front. So please, get your booster if you hadn't had it. And that's saved so many lives. And it's one of the reasons why Mississippi has struggled so much with our mortality rates, is because we're woefully under-vaccinated. As far as access to monoclonals, Omicron has thrown a pretty horrendous curveball in the sense that our most commonly available monoclonals don't work against Omicron. We will have more treatments available in coming weeks that are highly effective against Omicron, but we don't have them right now. And so it's incumbent upon every person to take the personal responsibility to prevent transmission to themselves and to their family and to their loved ones while we have this transmission going on. We know how to impede the transmission of coronavirus, and it's the simple stuff that's always worked. It's masking in public. It's doing things outdoors. It's avoiding large indoor social gatherings. And if we can just do that for a couple of weeks, we'll be in such better shape than we might otherwise be right now.
Thank you, Dr. Dobbs. Let's see. Oh, Shalina made you a doctor, Jim Craig. We kind of think of you as a doctor here. So let's see. Shalina is mentioning, she says, you mentioned hospitalizations of 445 COVID patients. How does that compare to the week before? And at what point would the state run out of beds? What level of patients would that be? Jim, can you take a swing at that?
So if you look at what hospitals reported for December the 28th, that was 445 confirmed COVID patients in hospital. If you look 6 days earlier, December the 22nd, there were 256 confirmed COVID patients in hospital. So, quite a bit of increase just in those 5-6 days. As far as, at what level do you run out of beds? There are plenty of beds in hospitals around the state of Mississippi. What we lack is staffing for many of those beds to be open and used. As far as, when will we run out, it really is a staffing issue and a staffing question. So we continue to monitor that, have the conversations with hospitals, and move patients through the system as best that they can at this point. As far as the level of patients, I think we're seeing all different levels. We're seeing folks that really just need med surge bed, but we're also seeing patients that are needing the ICU spaces. We are seeing a decrease in the number of ICU beds in the state. While there's still some beds available for various parts of the state, regionally we have some shortages in ICU spaces.
All right, thank you. You've asked me to move back to Kingfish's question. What is the current state allotment of monoclonal antibody treatments? And how many do you expect? Do you agree with the CDC's decision to stop shipping of the monoclonal antibody treatments. Okay, I am going to have you answer these because he is unable to join us, but we can go back and he can see this on the tape. So Dr. Byers, can
Yeah.
you take
I can answer some of this for sure. You know, with our most recent allocation of monoclonals that we've received in the state, we got 132 doses of the Regeneron product, 110 doses of the Bamedi product. And remember that those are the ones that are not effective against the Omicron, but remember we are still seeing some Delta, and 126 doses of the sotrovimab. So you can understand that we do have some supply constraints of those monoclonal antibodies, even though we are shipping those out and distributing to the hospitals, centers of excellence, so they can be utilized for those patients that need it. And certainly we're encouraging the hospitals to look at those most vulnerable patients or individuals who are severely immunocompromised to utilize that very precious resource that we have right now. You know, CDC did put a pause on the automatic distribution and allocation of a couple of those monoclonal antibodies that have shown really no effectiveness against the Omicron variant. But, you know, they have given us the opportunity to order additional monoclonals, and we're working on that now because we still do see some Delta in the state. Again, it's decreasing. By this time in the coming few days to weeks, certainly we may see even less Delta, but it is still out there, and we still want to be able to utilize that medication on the chance that individuals do have Delta, and we are still seeing some transmission that's occurring. So, you know, we're going to do what we can to continue to pull in as much of this as possible and get it back out to the providers who can utilize it.
Yeah, Dr. Byers, you said, you know, this is a real precious asset. And I just want to reiterate again, this should not be used instead of getting a COVID vaccine. Dr. Dobbs has said it. I just want to repeat it again. This is really for people who are ill. And of course, your doctor will be the one to recommend it to you, but it is a precious asset. So we're just asking everybody to do what they can to protect themselves by getting vaccinated and getting their boosters and following all the recommendations. I'm going to go to Nick Juden. And he says, I spoke to the superintendent of the Jefferson County school system who spent some of the district's COVID funds on providing high quality air purifiers for every classroom. Obviously, masks are part of the equation, but is there still time to do more for ventilation? Now, which one of you all would like to take that question?
I'll be happy to, Liz.
Thank
Certainly
you.
airflow is an important component of prevention, and we encourage folks to have properly operating airflow. ASHRAE has recommendations on how to do adequate airflow. Certainly we know that HEPA filters, certain high grade filters do work. I don't know, there's a lot of other products out there that are being sold that probably are not effective. And so I would be just cautious folks not to spend money on things that are like, you know, ionizing things or whatever that may not be as effective. But yeah, no, airflow is important. And as always, we strongly encourage folks to do airflow. And when the weather's good, open windows is very good. When the weather's nice, being outdoors is important. So, you know, that is one of the most important things with transmission, in addition to masks, which do work, is having good airflow so that any virus particles can dissipate as quickly as possible.
Thank you, Dr. Dobbs. This is from Nick Juden, taking a look at some of the hospitalization data out of states with more advanced Omicron cases is concerning. Ohio just recorded a number of hospitalizations. How can we reconcile the difference in hospitalizations across various settings? Do we anticipate Mississippi having an experience like Ohio's? And I don't know, or like, is that Gauteng's? I'm not sure what that is.
So it's hard to speculate. Everybody's experience with COVID has been a little bit different. You know, in some countries where they've had a significant increase in cases, or some areas that are highly vaccinated, they've seen a lot of cases, but not a lot of hospitalizations.
Oh, Dr. Dobbs.
Yes, ma'am.
Nick just informed me, I don't know if I pronounced it right, but that is South Africa. My
Oh.
geography was a little weak. Sorry about that, y'all.
I got it. So, yes. So, I mean, everybody's situation is a little bit different, right? So part of the situation with South Africa, it was a younger population of folks who got it. They're a younger country in general. So everybody's experience is going to be a little bit different. We certainly are going to see significantly more hospitalizations. We certainly are going to stress out our health system. To what degree is not clear yet. We do have a good number of folks in the state of Mississippi, a vast majority or a large majority that have some degree of immunity because of vaccination or infection, but it's not going to be enough. We need folks to get boosted. You know, if you get a COVID shot one year, you don't consider yourself protected the next year. You got to get a COVID shot a flu shot every year. So we will see a lot, and whether or not we'll end up like Ohio, it's really difficult to say.
All right, Dr. Dobbs, thank you. All right, let's see. Kevin is asking, with Omicron's emergence, are we approaching a point where COVID-19 is becoming endemic? Dr. Byers, talk a little bit about that.
Well, I mean, it will become endemic. I mean, and that's going to become part of the normal milieu that we see from a year-to-year basis. What that's going to look like in the future is kind of hard to tell. But I think what we're experiencing right now are epidemic increases, very similar to what we see with seasonal flu, although we've not seen a demonstrative pattern with COVID-19 to date that demonstrates any significant seasonality, other than we know that during the colder times of the month, historically, or the colder times of the year, when people gather indoors, we're going to see more transmission, and that just goes along with it. But I think what we're experiencing right now is epidemic increases of COVID, and we may experience this periodically for months to come. And certainly that's going to be largely dependent upon the emergence of new variants, the vaccination rate, whether or not folks are getting boosters to provide additional protection, and ultimately what we look like with oral antivirals and monoclonal antibodies and the effectiveness of them. So I think, you know, I don't have a crystal ball, but certainly we anticipate that SARS-CoV-2 will be part of the endemic landscape in the U.S., with likely some seasonal increases or periodic increases.
So we would be looking at annual vaccines then, potentially, right?
It's hard to know, but certainly it's plausible to suspect that we will see some level of routine vaccines down the road. But you know, we really don't. COVID has demonstrated that it's very difficult to predict, and certainly it's not done with us yet. And you know, we're going to have to kind of see. What we do know is where we are right this minute, and got a lot of cases, a lot of transmission, but we know what we need to do to prevent that transmission. So we just need to go about doing it.
Thank you, Dr. Byers. I guess we're going into New Year's Eve weekend, and we're seeing this incredible increase in the Omicron cases. Jim Craig, advice about New Year's Eve, anything you want to say? Because I know you're concerned about hospitalizations and hospital capacity and all of that. So let us know what are your thoughts?
Well, you know, New Year's celebration is much like many of the other celebrations. In many families, it's an opportunity for people to get together, whether it's in families or in big groups. Remember that you really need to think about that. If you've been fully vaccinated and fully boosted, you know, you have some level of risk mitigation that you've already done. If you've not done that, then this is a great time to do it. Get your booster shot. If you've been waiting to get it done, now's a good time. If you hadn't started the vaccination process yet, it's a great time to do that. The main thing is just be real safe and make some good decisions about being inside with anyone, wearing masks if you're in a public setting. You know, do those things we've been talking about for quite some time in this pandemic to help protect you and your family and the rest of us at the same time to the best of our ability. So we can maybe have a different conversation in the next year.
Thank you, Jim. Dr. Dobbs, you and I talked and you said the next couple of weeks is going to be a bear. Do you say that because of the New Year Eve celebrations, or what led to that statement?
Well, certainly holiday seasons have been a real challenge for us. When we have folks who are gathering and celebrating, it's a prime opportunity for COVID to spread. But also we're doing it now in the setting of the most highly contagious variant that we've seen. And we're in the midst of a peak of transmission that we've never seen, most likely, this whole pandemic. So, we've seen in other places that Omicron seems to rise extremely quickly, and sometimes it can drop quickly. So if we're fortunate to see that sort of experience, folks should protect themselves in the interim. Let it come down a little bit. Let's get a little bit stronger reinforcements in the form of effective monoclonals and oral antivirals, because the point of this is to survive and thrive. And if we have to make some moderate changes to our behaviors just for a couple of weeks to survive and thrive, makes a lot of sense.
Yeah, and we've been saying that Omicron is actually 50% more contagious than Delta. So it'd be really good for everyone to adhere to the advice. Dr. Byers, your concerns with Omicron coming up?
Yeah, I mean, it's rapidly spreading, guys. And I think the biggest concern that I have is that I anticipate that we're going to have a whole lot of cases. We may exceed some of the levels that we saw on a monthly basis with Delta. I would not be surprised at that, with how rapidly this is transmitting and how infectious it is. The problem when we have very large increases in cases is that that's going to translate to hospitalizations in certain vulnerable individuals, and ultimately going to translate to deaths. We hope that those deaths are low. We hope that the impact is low. We hope the impact is low on these long-term care settings where we're seeing so many outbreaks. And so, guys, be prepared. We do anticipate that there's going to be a lot of cases, and it is going to translate to a lot of hospitalizations and ultimately some deaths. So let's do what we need to do now to protect ourselves. I do have real concerns about how easily transmitted Omicron is, and with some of the transmission dynamics that we're seeing, even in work and social settings. And let's be smart, wear that mask when we can.
And we have seen, though, that with the vaccine and the booster with Omicron, it won't prevent transmission, but it will keep you from hopefully getting very ill, being hospitalized or dying, right?
Certainly, that's the beauty, and that's the payout for the vaccinations, is that they may not fully protect against symptomatic infection. Certainly, they may limit transmission and limit the viral load for individuals who are fully vaccinated or have received a booster. But the real deal is that if you've been fully vaccinated, especially if you've gotten that booster dose, it does reduce your risk of severe illness. And that's really what we want.
Thank you. And we do have one last question. Mr. Craig, this is for you. When will people be able to sign up for appointments at the new locations in DeSoto County, South Haven Community Safe Room? Right now, we don't see an area to sign up. It's probably not up yet. Jim?
The team's working to add a number of slots in the system, including those this afternoon. So later this afternoon, we should have those up probably by the end of the business day.
All right, thank you. It's been a while since we did this, so we hope that this was helpful. On behalf of Jim Craig, Dr. Thomas Dobbs, Dr. Byers, and myself, have a great afternoon and a happy new year.
Happy New Year, everybody.
Thanks, y'all.